Hello, my name is Dr. Cartwright Speakman. I'm one of the doctors here at the practice. Can I just get your full name and how old you are before we start, please?
Yeah, it's Harriet Josh and I'm 37.
Okay, and is Harriet okay?
Yeah, fine.
Okay, Harriet. So today I've been told to have a conversation with you about why you've come into the practice. Is that okay?
Yeah.
Okay. So with that being said, why have you come in today?
Basically, I just feel like super anxious all the time.
Okay.
I just feel like I'm constantly worrying about everything.
Okay.
And I don't really know what to do about it, if I'm honest.
Okay. How long has this been going on for?
I feel like I've always been somebody that worries.
Yeah.
I feel like I've worried throughout my whole adult life. But I feel like in the last, 4 months maybe, I just feel like I'm worrying even more.
Okay. And is there anything in particular that's caused you to worry more?
To be honest, I haven't really thought about it, but I have had a new boss at work.
Okay.
And I feel like I just constantly feel like he's like picking me up on things and looking at what I'm doing, and always feels like he's like over me the whole time.
Yeah.
Which is actually just like making me feel even more worried.
Yeah. Yeah. And is there anything else that you are particularly worried about?
Everything really. My children, my husband, work, just everything. When I'm at work, I think about my kids constantly, and when I'm with my kids, I constantly thinking about work, and I just can't stop worrying.
Yeah. And if you don't mind me asking, what do you work as?
I'm a lawyer.
Right, okay. So I can imagine that's quite difficult.
Yeah, it's quite high pressured at times, and this new boss is just, he's
Not
a
helping.
stickler, and he's just not helping at all.
Yeah. And when people are feeling quite anxious, they can have other symptoms as well. Sometimes they can feel irritable. Have you found that to be the case with yourself?
Yeah, actually, I feel like I'm arguing more with my husband about silly things like the dishwasher, which normally wouldn't really bother me, but that's really getting to me at the moment.
And sometimes as well, people can feel quite restless. Do you think that applies to yourself?
Yeah, I find it really hard to relax. My kids are constantly, they're only 10 and 8, and they're like, "Mummy, you need to chill out, Mummy." And I'm like, I just don't feel like I can. Like, even when everything's done and I'm in bed, I just find it really hard to go to sleep.
Yeah. How's that impacting on your life?
I just feel like I'm trying to catch up all the time. I'm always playing catch up. I'm really tired. I feel really groggy, which isn't helping. Yeah. Because then I think, am I not doing well at work? Is this going to be affecting my work? Are my kids all right? Are their homework going to be okay? Yeah. And it just goes through this. I just keep going round and round and round. Yeah.
It sounds like it's been quite a difficult past few months for you then, doesn't it? Okay. Now, there are a few other symptoms that I need to ask about, if that's okay. How's the mood been, would you say?
I guess they're just flat. I don't feel low. I definitely don't feel low. I just feel a bit flat.
And have you had any periods where your mood's exceptionally high?
No.
Okay. And have you noticed, for example, experience things that other people can't? So what I mean by that is, have you heard voices and other people can't hear them?
Oh, no.
Or seen things and other people can't see them?
No.
Okay. And do you feel like you're in control of all of your thoughts?
Yeah.
Okay. Do you feel like you're in control of all of your worries?
No.
Okay.
Yeah, I just don't feel on top of anything.
Okay. And sorry, just to go back to the thoughts, do you feel like people can put thoughts into your head?
No.
And take them out?
No.
People can't read your thoughts?
No.
Okay. Now I'm going to ask some difficult questions now, if that's okay. And again, if at any point you feel the need to stop and slow down, that's completely fine by me. We take it at your pace. Okay. So when people have symptoms like yours, okay, and feeling quite anxious, they can think about harming themselves. Is this something that you've thought about?
No, nothing like that.
And sometimes they even think about taking their own life.
Oh, no.
Okay. And sometimes they think about harming other people.
Oh, no.
Okay. That's good. And they can have physical symptoms sometimes associated with what you've been talking about.
Okay.
This could be shaking, for example, feeling a bit dizzy, feeling a bit sweaty. Does any of that apply to you?
I don't think so.
Okay. Sometimes as well, the appetite can be changed when you have, the feelings of worry that you've mentioned to me before. Is this something that applies to you as well?
No, not that I've noticed. I'm still eating as usual.
Okay, that's good then, that's good. You've given me quite a bit of information here. Is there anything that you think this could be yourself?
My sister has anxiety.
Okay.
And she's had that for quite a long time, and I feel like they're quite similar. Like I know that she takes medication for her anxiety. I guess I don't think I would want to do that, but I would. I guess I've come because I want some help. Yeah.
Well, I think you're in the right place for help. I agree with you. I think it does sound like an anxiety disorder, and obviously the hardest thing is admitting that there's an issue and coming to see help. You've done the completely right thing in coming to do that. And going forward, after this conversation, I'm just going to ask a few more things before we finish. But when we do finish, I will talk to one of my seniors and we can talk about what we can do in terms of treatment and therapy and things like that, if that's something that you would like to do.
Okay. Yeah.
Okay. And have I covered everything there in terms of concerns? Is there anything else that you're worried about?
Well, lots of things, but I think that's mainly it. Yeah.
And in terms of what you would like to get out of this consultation, what would that be?
Just some help, I guess.
Yeah. That's completely understandable. Just need to ask again just a few more questions now for completeness, just so I've got the full picture, if that's okay. So, do you have any other medical conditions?
No.
Okay. And have you ever had anything like this in the past? I know you said that you've been a bit of a worrier, but have you ever had anything this bad?
No. Like I said, I worry all the time, but not to this point.
Okay. And do you take any medication at all?
No.
Okay. And are you allergic to anything?
No.
Okay. And apart from your sister having anxiety, does anything else run in the family?
No, I don't think so.
Okay. And you mentioned you've got kids. Have you got a husband as well?
Yeah.
You mentioned. Okay. And do you all live together?
Yes.
Okay. And how do you find doing tasks at home?
Yeah, fine.
Okay.
I mean, it's a busy household.
Yeah.
My husband's also works in the legal sector, so
okay.
Long hours and things like that.
Yeah.
But we get things done.
That's good. And do you drink at all?
No.
Okay. And do you smoke at all?
No.
Okay. And any illicit drug use at all?
No, nothing.
Okay. Well, I think that's everything that I've got to ask today. Have you got any questions for me before we finish?
I don't think so, no.
Okay. As I said before, what I'll do is I'll go talk to my senior now, and we'll come back together and we can talk about the next steps about getting some help for the anxiety.
Okay.
Does that sound okay?
Yeah.
Brilliant. Okay. Thank you for talking to me.
Thank you.
On my mental state examination today, this patient appears anxious, restless, and was picking at her nails. Her speech is rapid and the volume is normal. With regards to emotions, the patient reports feeling flat. However, I would say that her mood appears to be anxious. Her perception is normal and she is experiencing no hallucinations of any sensory modality. Her thoughts are fast and racing and fixate on worries around work and her family. She exhibits no formal thought disorders and these thoughts are all her own. She has insight into her own condition, as she has stated that she thinks she has anxiety disorder. Finally, there are no issues with cognition. Overall, this patient is low risk of self-neglect and of harming herself or others, but the relevant treatment options should be discussed with her during this consultation.